Dr. Hinchcliff, what testing should people with endometrial cancer undergo after diagnosis?
So, when I think about a cancer diagnosis, there are first sort of two big buckets of things that are important to understand. One is the cancer stage, meaning where did the cancer start, and then where has it potentially spread to. The other is the cancer histology, or what do the cells look like under the microscope. And in endometrial cancer, there are actually a variety of different subtypes of endometrial cancer that can be differentiated based on what they look like under the microscope. Once you have those as your framework, I think the next step is to better understand what's called biomarker testing, or kind of the genetics of your cancer.
Would you define biomarker testing? What does that mean?
Yeah, so biomarker testing, while under the microscope we can determine what kind of cancer something is, we can't tell what's going on inside the cancer cells itself. And so biomarker testing is a sort of umbrella term for a variety of different tests that really try and assess what's going on inside the cancer. What are kind of the genetics making the cancer cells divide and grow abnormally?
That's excellent
And then
news.
also, what are the things
How
that
can
might be
patients stay up
expressed
to
or
date
kind
with
of
treatment
on the cancer
options?
cell surface that are potentially targets for us to leverage to treat the cancer better? So what is kind of unique to that cancer, either the patient's own cancer individually or that cancer type in general, that we can use to our benefit to treat the cancer better?
Mhm. What are the most common biomarkers associated with gynecologic cancers?
Yeah, so in endometrial cancer specifically, I think if there are a couple take homes that I can emphasize to patients in this talk today, the first is it is essential to know your what's called mismatch repair status. So, mismatch repair is one of the things that can happen inside a cancer cell. And when that goes awry, when that becomes abnormal, it means that the cancer has particular features that we can use to treat it better. And so the two categories of mismatch repair are you can be mismatch repair deficient, meaning there's something abnormal in that machinery inside the cancer cell, or mismatch repair proficient, meaning that that machinery is still intact. And the reason for that being so important is that in endometrial cancer, if someone's cancer is mismatch repair deficient, we can use a whole class of drugs called immunotherapy, or leveraging your own immune system using medicines to try and treat that cancer better. So I think that knowing that about your cancer type is really essential in endometrial cancer. I think the other thing that is important to know is in endometrial cancer, some subsets will express a receptor, so basically something on the cancer surface called HER2. And if you are HER2 positive, that also can be a target for potential drugs. So those are two really important biomarkers in endometrial cancer that I think it's important that patients know that they have been tested and then know what their results are.